And welcome back to Boom and Bust. I'm your host, Tony Clement, having a conversation with Bacchus Barua. He's the Director of Health Policy Studies at the Fraser Institute. Bacchus, we're talking about how Canada compares uh, within itself, but also amongst peer nations. Are there nations out there that are doing demonstrably better in their healthcare system? And if so, why do they do better?
Absolutely, there are other countries that are doing a better job of this universal healthcare promise that we cherish so much. And that's why we do the study, so that when we look at a broad spectrum of 40 indicators, we can try and understand who's actually doing a better job, who has more physicians and who has shorter wait. And we do get a group, we get a group of countries that include Switzerland, the Netherlands, Germany, Australia, sometimes France and Sweden, although they're starting to flip as well. And I like to focus on a group because I find that, when you look at one particular country at a time, you might have, some things they do better or some things that they don't. But
Fair
this
enough.
group tends to do better. Okay. They tend to have more resources. They tend to have similar outcomes and they tend to have much shorter wait times. Just to give you a quick example, when you look at the wait time for getting a specialist, the percentage of patients in Canada who had to wait more than a month for that was 65% in 2023, according to the Commonwealth Fund. In Switzerland and the Netherlands, it was half that amount. It was about 36%. When it came to wait times in order to get on emergency care, in Canada, about 60% of patients had to wait more than 2 months. And in Germany and the Netherlands, it was about one third of that. It was about 20%. And this is actually all after COVID. I would say in 2021, when we were looking at earlier data, the results were even more stark in terms of these higher performers. Um, but to your next question, what do they actually do differently? And I think, from the deep dives that we've done into each one of these countries, there are three broad things that we can talk about. The first is their attitude towards the private sector within a universal healthcare framework. In Canada, it's really, still taboo to talk about the private sector in many cases. Although I do think Canadians are far more aware of the benefits that we can get when we partner with them. But these countries just have a different attitude. They focus on the patient and the services that are being provided, and the system comes second. So the idea is get them the treatment, and it doesn't really matter whether it's public or private, but you focus on the patient. You pull the private sector in and partner with them if the system can't deliver, or at the very least, you allow it to be a pressure valve. The second thing that they do very, very differently is they expect patients to share in the cost of treatment.
Mm.
Yes, again, that's something that we, have difficulty talking about in Canada. But even in countries that have, an entirely public universal healthcare system, they generally expect patients to share at least a little bit in the cost of treatment. Is it done through deductible or co-insurance payments? And of course, they understand that these are not meant to be a financial burden. So you have exemptions for, populations like pregnant mothers, or exemptions for those who are chronically ill, or who have an acute emergency. But everyone else is, just trying to get the right signal to them so that they're using the right resources and these scarce resources more appropriately. And the third thing is that they fund their hospitals on the basis of activity. In Canada, because of our large reliance on government for funding,
Mhm.
we are generally stuck with what's called a global budgeting approach, which
Right.
essentially says the governments are dictating your budget and then you have to kind of function within them. What this does from an incentive perspective is it makes hospitals think of patients as a cost because whenever a patient comes into a hospital, they're eating into that budget. By contrast, the vast majority of countries that we're looking at have moved to activity based funding, which essentially means make money follow the patient. So every time a patient comes into a hospital, the hospital actually gets money in order to treat that patient
Right.
according to the complexity of their condition. And of course, they can do it because they have a much more dynamic system with money coming in from both the public and the private sector. But these are the three big things that they do differently. And I like to think of them as the idea of partnering with the private sector is a supply thing about being able to expand your supply. The idea of cost sharing is about demand. It's about tempering your demand. And the idea of activity based funding or money follows the patient is sort of like a lubricant in the system so that you're getting the right signals in place for resources to go where they're needed the most.
Yeah, no, I think that's important that the market signals are not just an efficiency method, it also provides the best care to the people who need it at that particular moment in time, which our system doesn't necessarily do that all the time. Bacchus, we're going to take another brief break. Lots to talk about still. Glad you're on the line here, and we'll get back to you after these short messages.